going to meet one of our scientists who obtained the Nile Award for his achievements in medical science in 2015. Professor Dr. Tegeldin, the former Minister of Health and Population in Egypt, who told us about his long journey with diseases and cure from the start in his family house.
I was born in a big family, father and mother, and we were 8 children, and it was a very tight family, like any Egyptian family. And from the beginning of my career in the secondary school, I chose to study medicine, so that I prepared myself from the start to study medicine. And my father, he was a very good man because he supported me very much in my choices to study medicine. Also, he supported me during my study in the secondary school. He was perfect in the languages, both Arabic, English, and French. And still I am keeping, up till now, some of the papers which was prepared from him to me during my study in the secondary school. Then I joined Ain Shams Faculty of Medicine in 1962. It was a very good study, and during our study in the Faculty of Medicine, the number of students were not so high. The number was about 200, so that the size of my colleagues, the number was not so high, so that definitely it was a very good study in my faculty, my college, Ain Shams University, which I graduated from the Faculty of Medicine in 1968. And up till now I am keeping, as I'm graduated, and then I was house officer for 1 year, and then after that I was resident for 3 years, both chest disease, pulmonary disease, and medicine. And then in 1973 I was assistant lecturer, and then I take my PhD, which is MED in medicine, in 1975-76, and then I graduated from lecturer to assistant professor and then professor. During this period, during my study in the Faculty of Medicine, it was very rich because we have many activities, both scientific, educational, sports, in every aspect. I was member of the student at that time, and students syndicate, and during this time we have a magazine. We visited many areas in Egypt, and I remember in 1968, after 1976 war, we visited the front area in Suez, and they have a magazine at that time reports our visit to this area, which was very active at that time. Then I visited many other countries. After my PhD, I visited France, England, UK, and USA, Sweden, and Japan, and many other countries. The main purpose of these visits is to take some experiences from different areas all over the world, and it was reflected on our career in Egypt and definitely reflected also on our patients. For example, when we visited France, the first intensive respiratory care for pulmonary medicine and for critically ill patient was at Ain Shams University at our hospital, and many of our young colleagues trained on the intensive care, and the idea of the intensive care saving the lives of many patients is distributed all over the country and even in the region in other Arabic countries. Also, the sleep medicine, which makes some studies during sleep for the patients suffering from certain problems in the respiratory system during their sleep. So that with many others implementation of the new technology which we we trained and then we implemented in our country. So that we have a school. Many of young colleagues were trained with our experience, not only with my experiences, but with experiences of other colleagues in different parts.
Dr. Tegeldine chose a new topic for his PhD in Faculty of Medicine at Ain Shams University, and he told us why he chose not to study abroad in spite of his good language skills and his financial capability to do so.
I registered PhD here. It was very good, and the idea of my thesis was very new. It's published all over the world. I have a very good recommendation after discussion of my thesis. One of the recommendations is this thesis must be published by the university for the Egyptian universities and also to be distributed to all over the world. But my professor, my senior professor, who is supervising me during my studies, he recommended that he told me, take your PhD here and be a lecturer here, and then you can go to other countries to be trained on new technology and also to make some of your papers or your experience of your studies, which is very good idea. If you travel with deep experiences from your country, you are qualified, you have some experiences, definitely you will get the more experiences in other countries. And this was reflected when I visited Sweden. During my visit to Sweden, I made some research, some papers, and the supervisor there told me, you have 3 or 4 papers, and these papers, if you are not graduated, you are a PhD candidate, I think these papers will take 3 or 4 years. But for me, it takes only for a few months.
Dr. Tegeldine graduated from the Faculty of Medicine in 1968 with a Bachelor of Medicine and Surgery right after the 1967 defeat in Egypt, which had a significant impact on the youth at the time. And as a member of the student syndicate, Dr. Awad told us how he experienced the whole situation and the way he dealt with it.
We were, as I told you, in the syndicate of the students, and we have different activities. Most of the activities is related to improve the quality of the students, and we have at that time some experiences with the politics in the country. But I told you frankly, I was in the last year of my study, and then we are confronted with the 1967 war. It was shocking for us because we were expecting some good news, not bad news. But I think after few years at 1973, we have a very good victory at that time, so that improves the bad experiences from 1967 war.
Dr. Awad Tegeldine started his journey in teaching as TA or teacher's assistant in the Faculty of Medicine in the University of Ain Shams, and took the ladder to success step by step until he reached head of the University of Ain Shams, passing by being a professor and a dean, and he told us about his long and rewarding journey up until this moment.
The study of medicine of Egypt is very good, and the quality is very high. Although sometimes we are confronted by some lack of the, for example, instruments or materials, etc., especially after the period in which the economy is not so good. But the quality of the students is not bad. The quality of medical doctors in Egypt is very good, but they need more experiences and more training, continuous medical education, which is very important. So that at the level of graduation for the undergraduates from the Faculty of Medicine is very good. And I told you that we have a very long experience in that, but I will tell you something. We have many thousands of the Egyptian graduates from the Faculty of Medicine working in many Arab countries, and they need a very good standard. We have many graduates for a very long time, thousands, working all over the world, in the States, in European countries, everywhere. Definitely they need some polishing, some experiences, and it looks like any specialty, medical or non-medical, you must be trained. So that training is very important. Continuous training is very important. This is the only point after graduation from the Faculty of Medicine.
Recently been an abundance of private universities in Egypt. How would Dr. Tegeldeen evaluate those universities and the standards they had to live up to, since he was the head of the committee evaluating private universities' faculties of medicine?
I was president of Ain Shams University, and I am member of the committee which was established to evaluate the private universities. And we visited, only now we have two faculties of medicine, private two faculties of medicine. And now there is marked improvement in the quality and the training at this private university. Keeping in your mind that most of the professors, maybe all of the professors, working for training of the students, not only in the Faculty of Medicine, but Faculty of Dentists, Faculty of Pharmacies, etc., they are members of the staff of governmental universities. With the good training of the students and training after graduation in special hospitals, I think the quality will be good. It will be similar to the graduates of the governmental universities. That is why we decided to have a university hospital for each Faculty of Medicine, private one. It must be a university hospital for training of doctors. And we decided at that time, as I told you, I was a member of the committee which evaluated the medical schools, private medical schools. We make links between the private universities and the governmental university to give them more chances for training of the students and the graduates. It is decided the differences between the grades of the private and the governmental university is it's a very narrow range. So it is not low grade. This is one point. The second point, it's not low grades. 85% or 90% is not low grade. You mean the differences between the grades of the governmental hospitals and the private hospitals. So that the difference between 90 and the 95 is not so high. Because if the number of students decided to join the Faculty of Medicine is low, you can take students with 75%. So that this is not low grade. It is only, you mean, the range between the grades of the governmental and the private schools. Keeping in mind that we have many students, not only from Egypt, from other countries. And this is very important because if you have students from other countries, they makes for us so they will be ambassadors for Egypt in their countries.
After becoming the head of the University of Ain Shams University, Dr. Awad Tageldeen was chosen to become the Minister of Health in 2002, and he spoke to us about his experience in the ministry.
Before the Minister of Health, you must mention that I was Vice President of Ain Shams University 2 times, and then I elected after that as the President of Ain Shams University, and then I am selected from my position as the President of Ain Shams University, which was a very good experiences because I told you I'm graduated from Ain Shams University. I spent my life working at Ain Shams University. I didn't go outside the country except for scientific visits or scientific training, so that it was a very good experience to be President of my university, which is the highest scientific and administration position in this university. After that, I have the privilege to be Minister of Health for about 4 years. And it's very good experiences to serve in this position because you give a lot of your experiences to improve the quality of health care from preventive and curative medicine in Egypt. And I'm so glad that during my time in my office as a Minister of Health, I succeed to eradicate poliomyelitis from Egypt. Me and the other colleagues before and after me, we decrease the prevalence of schistosomiasis, bilharziosis in Egypt. Also, we started to implement the family units, which is the base of medical insurance, because you have the idea of have family units or family centers serve for basic benefit package for the patients for certain numbers of families in each area in about 5 kilometers, so that you decrease the pressure on the large hospitals. Also, you give the patients the medical services, the basic medical services in good quality and in easy way and more or less in very cheap prices. As I told you, I was physician, I was professor, I was president of university, and at Ain Shams University we have a very big hospitals. We have between 3,000 and 4,000 beds. It is very large. And also in my position, I was working with the Minister of Health in many aspects, including prevention of smoking, tuberculosis, chest problems, etc. So that nothing is astonishing. But definitely, up to now, we want to improve the quality of health service in Egypt. And I'm sure that by implementation of health insurance, we can improve the quality of the services provided to the patients. Because still, more or less, we have 53% of the population covered by insurance. We need to increase this number because the medical interventions and the new aspects of management, including diagnostics and treatment, is very expensive. And any one of us at certain stage, he cannot afford the expenses of medical service. So that the best resolution is medical insurance, implementation of medical insurance.
organization of health services in Egypt suffers many obstacles and deficiencies. Yet, through his long experience, Dr. Awad has a vision as to how that organization can rise once more.
I think it is cumulative process for a very long time, because the expenses, as you know, now the percentage of the money which is dedicated for medical service is increased from the total income. But yes, well, maybe more after that. But we need to improve. No, it's not enough. We must improve the amount of money for the medical services, which can be improved by the medical insurance, because everybody can share by certain percentage which is affordable for him in this medical service. For example, now if you can go to private doctor and you spend, for example, 200 or 300 pounds for management, for examination and the medications. But if you are insured, you can, instead of 300 or 400 pounds, you can spend 45 pounds or 50 pounds. So that if this concept that we can share with certain percent, with ceiling of this percent in the medical services and in the medications, I think we can help together to implement the medical insurance. So that, as I told you before, the expenses of diagnostics, interventions, now if you go to make cardiac catheterization with stents, about 30,000 pounds. Not who can afford that? So that we need medical insurance. I'm sure that the implementation of the health insurance all over the country will improve the quality of health care, also will satisfy the patients and their families, because they will receive proper medical services in good quality and in very low expenses. At the same time, with the improvement of quality of the insurance, and also you must satisfy the providers of the health care. I mean by providers the doctors, physicians, the nurses, the workers in the insurance, and the other groups in the health sector.
Healthcare depends all around the world on the relation between the citizen and the government. So what are the limits to that relation, and what is the citizen's role in it?
The citizen, he must be a member of the insurance. We have some groups working in the government or in the factories or in other areas, some of them already covered. I think with a proper cooperation and proper transparency between the providers and the patients, we can reach a very good health insurance system. Maybe with some points which is maybe not improving the quality of the services, but I think the long-term management of supervision, equity, transparency, good performance, we can reach the maximum of a good health insurance system.
Egyptian college hospitals are considered great opportunities for medical students to train, learn, and help those in need of medical attention. And Dr. Awad had something to say about them.
The university hospitals are very important. They are teaching hospitals, qualifying hospitals for the postgraduates. Also their health services is very high standard, and also it's for research, etc. And this is very important for quality of doctors in Egypt. And a few minutes ago I told you that for private universities, they must have a university hospital. So that university hospital is a very important component of the teaching, medical teaching. Not only for physicians, for dentists, for physiotherapists, for pharmacists, and for nurses. When we implement the health insurance, the university hospitals will be one of the components of the health insurance. Why? Because the health insurance will be under umbrella of certain body. This body will be collecting the money, finance, will be supervise the services, will put the quality standards for these services, etc. But he will pay for services in every facilities available in Egypt, because we have a lot of facilities. Private. Now still the health insurance also it cooperate with private sector, because it's much cheaper for him to get the service from radiology center, from lab, and from the hospitals. Even the insurance hospitals now will be part of the health insurance. It will be independent. As a hospital, it must be a good a body, both financially and the services. As I told you again, the body of the health insurance will be supervising and put the criteria for management. It will be implemented, as I heard, gradually in certain governorates until we reach the maximum of total coverage, maybe 7 or 8 years later.
Dr. Tegeldeen was Minister of Health and Population from 2002 till 2005, but he never forgot that the occupation was temporary and that he would always go back to being a professor and a doctor.
I am a physician with deep experiences in my field. I am professor at university, so that and from the start we know that the position of the minister is limited. It might be short time or long time, but after that you must return to your work. But I am so happy that I already served for my position as a Minister of Health in good way that improves the quality of medicine in Egypt, both from preventive side and the curative side.
It was only natural for Dr. Tegeldeen's work to get associated with the World Health Organization, also known as the WHO, with which he worked in different fields, such as consulting in the field of respiratory system diseases and combating both smoking and tuberculosis.
WHO is working with ministries of health and the governments, and definitely they have a relation with every country to help. They help in the international medical problems. For example, when they have H1N1 influenza or any other disease, or even in Africa they have some problems, so that they help to organize the expertise and the system to put some guidelines for prevention or for management. This is the main job of WHO. The regional office of the Middle East and North Africa is present in Egypt, in Cairo. and so that the cooperation, and we have WHO representative for Egypt, and still we have, and the Ministry of Health have very strong cooperation with them.
The industry of medical drugs is one of the most important industries, and Dr. Tegeldine has a clear point of view on it.
The pharmaceutical industry in Egypt is very strong one, and it will establish for a very long time. And I want to assure you and everybody that the quality of pharmaceuticals of Egypt is similar to any other imported pharmaceuticals, including the raw material, the manufacturing process, which is already under good GMP, which is good manufacture practice. There is no difference between the imported and the drugs produced in Egypt. And we have 2 points with that. One of them, that many international or multinational pharmaceuticals already manufacture their drugs here in Egypt, in the Egyptian industry. The second point, that many of our planets export the many pharmaceuticals abroad, not only for Arab countries or African countries, but even to European countries. So that I am involved deeply in this important point, and I will assure you that we have a very good quality of pharmaceuticals. And I am Egyptian physician. I prescribe medications for my family, for myself, for my patients, and you know that the first priority for any physician is his patients. So that if there is any suspicious of any defect in the pharmaceutical industry, we will not prescribe this medication for our family or our patient. This is a very important point. The second point, the production of pharmaceuticals in Egypt is cover about 90-95% of our needs from essential pharmaceuticals. Okay? This is a sort of national security, to have your pharmaceuticals for your patients easy available for every day. The third important point, if you import the same medications which are already here in Egypt, produced locally, from abroad, the expenses of this medication will be multiplied by 10. All of these factors are very important for national pharmaceutical production. The pharmaceuticals here are cheap. It's very cheap if you compare the prices with any other country. This does not mean that the quality or the contents or the composition of the medication is not, because for each drug, if you register drug from the Ministry of Health, the contents of the medication, the raw material, how many milligrams or grams, how many tablets, is already registered on the package. And there is continuous assessment of the pharmaceuticals, started from the raw material until the drugs which are available in the pharmacies. And even they collect some drugs from the pharmacies for a check-up every now and then. The doctors prescribe the medication which is already registered in Egypt. any drug present in the pharmacies in Egypt must be registered by Ministry of Health. Either is it locally produced or imported, and no harm from the physician to prescribe the drug because it's already registered and assessed by the Ministry of Health, and it's available in the market. Okay, maybe it's some concepts, maybe some ideas, but still, as I told you, I will not ask the patient to bring his medication from outside because this drug is already registered and present in the pharmacies. Because the expenses of the pharmaceuticals is increased. We have drugs which already, the prices of the drugs is fixed by the Ministry of Health. Some of the drugs are priced 20 or 30 years ago. I told you that the raw material is imported. Many components are already imported, but the industry is not imported. So that we have raw material, we have packaging, we have glasses, we have aluminum, we have many things. We have electricity, we have water, we have workers. They want to increase their salaries every now and then. Already it is increased. We have many expenses for this industry. So that every now and then the total expenses is increased and the prices are fixed. So that change of the prices or increase in the prices with 20% for the pharmaceutical less than 30 Egyptian pounds, it will be reflected partially for improvement of the performance of the companies. And as you know also, the prices and of the imported raw material is increased. So that it's only partially for certain pharmaceuticals, and it will be reflected on the improvement of the performance of the company.
A recent outburst of alternative forms of treatment that are not necessarily medical, and we asked Dr. Awad Tagildeen whether such treatments are truly effective, although they follow non-medical methods.
Plants or herbs, or what we say that it is alternative medicine. For you, there is no alternative medicine. There is some material, some herbs, etc. It can help to improve the patient with symptomatic management. The drugs or the pharmaceutical treating the diseases are prescribed by doctors. So that I recommend for everyone not to go with something which is published in the media without any scientific background. And even by law, it's prohibited to make some publicity about some medications or herbs managed the patient without permission from the Ministry of Health. Please don't go with these ideas or this media, because it's very, very dangerous. The medications used for the management of diseases is already permitted by the Ministry of Health, and it is published in the scientific journals, scientific congresses or meetings, not by television.
Dr. Awad Tagildeen is currently head of the Egyptian Organization of Chest Diseases, which was one of the oldest health and science organizations in Egypt.
We have the Egyptian Society of Chest Disease and Tuberculosis. It is a very strong, well-established society. Its age is around 65 years, and every year we have a very large scientific conference. Usually it is during March every year. We invite most of our colleagues in the field from Egypt, from the region, and we have some international expertise to transfer the regional, national, international experiences in this field, which will be reflected definitely in positive way and also we have many workshops, we have many international speakers, so that we improve our experiences and the experiences of our colleagues from different parts of the countries and also from the region. We have our journal, scientific journal, which is now published by the international expertise in this field. It will support it to publish the Egyptian research. And even we have many researchers from outside the country and from the region and from international researchers publishing their papers in our journal. Definitely this journal also expose the international and the national experiences in the field of medicine.
Recently, we can see many television shows based off medical backgrounds that are aired and made with the purpose of increasing general medical awareness, and we asked Dr. Awad Tagildeen whether those shows actually fulfill their purpose or is their effect not strong after all.
Sometimes we have a very strong medical programs, and other times it is weak, but if these medical interviews or medical programs organized by expertise in this field, it will be much better, and definitely it will improve the scientific preventive measures for the patients. It was very useful helping us in eradication of certain diseases, including poliomyelitis, also bilharziostomitis or bilharziasis, and education for influenza, etc. But it must be very accurate, very clear, not providing any data about self-management by the patients.
Egypt has been able to overcome illnesses such as tuberculosis. In his opinion, Dr. Awad Tagildeen tells us about Egypt's next medical challenge and his vision.
Definitely, there is improvement in the Egyptian health. We have parameters. It's not personal impression, it is parameters. The first parameter is the morbidity and the mortality for children in the first year of life, and the first 5 years of life is markedly decreased. The second point, that we have eradication of certain very dangerous diseases. I told you about poliomyelitis, schistosomiasis, parasitic infestation like scaries, inclustoma, etc. We have eradication of mumps, marked eradication, diphtheria. There is no malaria in Egypt. If there is some cases recorded, it is imported from outside. Also, one of the diseases which was dangerous and still very dangerous all over the world, but it is markedly decreased in Egypt, is tuberculosis. The prevalence of tuberculosis in 1950s I mean, it was estimated by how many new cases for 100,000 population. In 1950s, it was 350 over 100,000 population. Now it is 15 marked decline in the prevalence of tuberculosis. This is not coming from, it's coming from a very good performance of the National Tuberculosis Program with my colleagues all over the country in the chest hospitals, the chest centers, and in the program, the availability of anti-tuberculosis treatment free of charge, the availability of diagnostic measures free of charge, and the detection of new cases and proper management leads to decline in tuberculosis. Another important parameter is the life expectancy. The life expectancy 20 years ago was around 50s. Now the average life expectancy is 73. So that there is marked improvement. But now we are suffering from certain diseases, which is the new century diseases: hypertension, diabetes, the more detection of cancer cases, which are also related to aging population, and still we have many bad habits, which is reflected on the health of Egyptians. Number one is smoking. The prevalence of smoking in Egypt is markedly increased. And unfortunately, it is markedly increased in the younger generations. And the side effects and the bad effects of smoking is cumulative. I mean that once you smoke more, for more longer years, more number of cigarettes or shisha, etc., the side effects is severe, including different types of cancer and the more dangerous disease called chronic obstructive pulmonary disease. It's obstruction of the respiratory system, which is reflected on the patient in very bad situation, and he will be handicapped. The second important negative point is air pollution. And now we see from our branch many cases of diseases related to the air pollution. More cardiac patients, more hypertension, more ischemic heart disease. This is the modern disease. So that there is improvement in the quality of life of Egyptians, there is improvement in chronic diseases, but now we have new era of many diseases which can be preventable by complete smoking, air pollution, and also another important point is obesity. Obesity is reflected one of the causes of hypertension, diabetes, ischemic heart diseases, joint diseases, etc.
Dr. Awad Tagildeen lived his life in between books and terminologies. But what does he do when he exists the hospital, and what is his leisure time dedicated to?
I like very much reading. And every day I must read, not from from scientific books or medical books, but for many other aspects, which is very important for me every day. Now there is no specific sports, but sometimes I have some time talk, which is very important for everybody, for his health and my health definitely, and also for prevention of some problems. But the other hobby is that I need to sometimes to discuss with my colleagues some national problems or national situations, which can we exchange the ideas about that. I read for Naguib Mahfouz, Yusuf Idris, many of the writers in the Egyptian journals and magazines, and sometimes international books, which sometimes reflects some international ideas. Movies, sometimes if I heard about a good film, either Egyptian or non-Egyptian, I look to see it, but maybe not in the cinema, maybe most probably in television. I like very much my colleague Yahya Al-Fakhrani. He is my colleague. He was my colleague in Faculty of Medicine. He's doctor, and also his wife Lamis Gaber. They are my friends, and I look very much to see Yahya and the publications of Lamis.
Finally, Dr. Awad Tagildeen spoke about the future of Egypt's health to us.
It would be improved, definitely, with more implementation of preventive measures, more availability of early diagnostic techniques, proper management of the patients, improvement of the quality of the hospitals and treating centers, and also improving the quality, the life, the care of the health providers.